Welcome to Nz-Osce learning sessions. Today we will go through Station 9, Planning Nursing Care. You have to read the scenario carefully for 2 minutes. Here, our practice setting is Aged Care Residential Center. You are a registered nurse working in this aged care. You are doing an initial assessment of a resident who was admitted 2 days back. Your resident is so and so, a New Zealand European. He was admitted in the aged care 2 days back. His initial assessment is pending. When you entered the room for doing an assessment to plan the nursing care, he is speaking to his granddaughter over the phone. He wanted you to sit there for a while and you are hearing the conversation between them. Our recommendations are: you have to prepare a nursing care plan for this patient. Identify 3 nursing problems and plan 1 intervention and rationale for each problems. You can ask 3 relevant questions to him which help to prepare the nursing care plan. You should be verbalize the problems, interventions planned and rationale behind to the examiner. So read the scenario carefully for 2 minutes. Our countdown begins for 8 minutes with the warning bell at 6 minutes. As always, knock the door before entering the room, ensure the scene safety, provide privacy to the patient, and perform hand hygiene. Meanwhile, you can introduce yourself. Hello, good morning. I'm your assigned nurse. I'm here to do assessment and I would like to plan nursing care accordingly. Oh, sure. Please have your seat. Actually, I am in the phone, talking to my granddaughter. Oh, thank you. And he will proceed with the conversation in this manner. Actually, my nurse is here to do my assessment. Yes, doctor. Actually, I am happy here, but I am not satisfied with the food they provided here. The problem is they give spicy food, but I prefer fruits and vegetables. That makes me constipated. Last night I have incontinence too. I don't sleep well and also feel shamed sometimes. And one more thing, because of my Parkinson's disease, I don't walk properly. They keep a walker nearby, but I don't know how to use it. It would be fine if you can come here because I feel lonely. Could you please bring a few books to read? I will be fine and feel good. He will end up his conversation like this way. So what are things you heard from his conversation? He discussed the problems. He didn't sleep well. He has this urinary incontinence. He needs support to walk. He dislikes the food which you are serving. And he has constipation, he mentioned, and also he feels lonely. Here, the problems may vary at any time. The patient might mention that he had constipation, but a nurse from the previous shift gave him a tablet to ease his stool, and now he is feeling better. You need to listen carefully what he says over the phone and be alert to any updates. Based on that problem only, you have to ask the relevant question and you have to plan the nursing care. And also keep in mind that if you ask more than 3, he may not respond at that time. So always make sure that the problems may vary accordingly. Station, our listening capacity or listening capability and also how well you are responding and planning to a nursing care and planning to care to your patient appropriately to their concerns are assessed here. So be careful, you have to listen appropriately and accordingly you have to plan your nursing care plan. Am I clear? Okay. So you can ask what all things to be asked. The question is, okay, you can initiate your conversation like this way. Okay, I heard your conversation from that. I identified certain problems that really bothering you. What do you prefer? Or what kind of food do you prefer instead of meals being served here? That means I identified nutritional status is a main problem. And second question may be, could you please tell me about your voiding pattern? Or do you experience urinary urgency during day, at night, or both? That means you identified incontinence as a problem. Moving further, related to constipation. How often are you experiencing this constipation? Or when did you last open your bowel? Moving further, how often do you have this trouble sleeping at night? Or do you find hard to get sleep at night? That means you identified his sleep pattern is disturbed. And finally, do you feel safe while walking, or do you need help to move around, or would you like someone to assist you? That means he is having problem while walking. As he mentioned, he is having Parkinsonism, so risk for fall. So questions, you can prefer anything from this, but you have to listen carefully what he said or what conversation he made over the phone. According to that only you have to make the care plan. So let's start. After preparing 3 questions or 3 problems, you have to introduce in front of this examiner. As after completing the assessment, you have to verbalize that I have identified 3 problems, planned appropriate interventions, and I have a strong rationales to support them. Okay, let's start. I'm so and so. I'm a registered nurse taking care of this patient, so and so. After my assessment, I found that he is facing some issues. From that, I have identified 3 major issues my patient is facing right now. I have planned specific interventions along with a clear rationale for that. I identified during the patient assessment along with the planned intervention and their rationales. And the first problem I identified is imbalanced nutrition less than body requirement. First, I will evaluate the patient's nutritional status and dietary preference. Based on this, I will collaborate with dietitian to develop a personalized meal plan. And this ensures that patient receives a balanced and sufficient diet that meets specific nutritional needs and respect their preference. And my second problem I identified is urinary incontinence. I will establish a toileting schedule based on the patient's usual voiding patterns, encouraging them to urinate every 2 to 4 hours. And also I will educate and assist the patient with some exercise. And my rationale behind is a regular toilet training prevents over distension of the bladder and it reduces the episodes of incontinence. I offer him a sensory pad. It helps to assist him for his activities. That's my second problem identified for my patient. And the third problem I identified is constipation. I will promote a fiber-rich diet that includes plenty of fruits, vegetables, and whole grains. Additionally, I will encourage patient to drink water, and definitely I will offer laxatives. And the rationale behind is adequate hydrations that soothes stools and helps to add bulk to the stool and support the bowel movements. So these are my 3 problems that I identified for my patient. These are the 3 problems I identified for my patient. Here in this station, while preparing a care plan for your patient, it should be definitely patient-centered, respecting their individual needs and preferences. And my interventions are based on the current evidence. And I make sure that the plan is realistic, and always involve the healthcare team and the patient in decision making, and continuously evaluate the plan for any necessary updates.